Hey, and welcome to a brand new episode of the Straight Up Show podcast. I am your host, Calvin Rollins Soto, today, and this is our opening episode for season 4. We're back. We're back, and we've been doing great things. And I finally had my nasal surgery, my sinus surgery, and I hope if y'all listening, I sound much better than I did before, but I feel a lot better, and now I got to keep on pushing. And so just some good news catching up with everybody. We are back. We celebrated our 1 year. Thank y'all so much for the support. Doing great things, especially our trips in Africa, in Europe. Shout out to all those people in Kenya, Ghana, Nigeria, Congo, actually, and Ethiopia too. So a lot of y'all, thank y'all so much for y'all support, and Egypt too, and France and Ukraine. So bigger news, we actually just partnered up with WBOB radio station out in Florida. Thanks to those, because we now can be heard Sundays at 5 p.m. at WBOB Radio Live, WBOB Radio.live every Sunday at 5 p.m. Central Standard Time. So thank you so much to those guys out there at WBOB for picking our show up. And so much blessings has been happening since we last spoke, and a lot has been going on. So on today's episode, we're going to jump right into it. We're going to continue with our series called The COVID Impact. And we had so much of this pandemic that impacted our lives that it just can't be talked about in one case. There's so much going on. Now that we have a brand new administration, and we have to give props to the last administration as well for having Operation Warp Speed. But now we have people getting these vaccines now, and things are beginning to open up. But the thing is it safe right now? You got your vaccine. Is it safe going out and about and living your everyday life? So I want to bring back today a great friend of our show. A lot of people that, if you listen to the season finale, season 3, they love this episode because it was so informative. It got people ready for the vaccine, and it actually had some people kind of nervous as well, with great reason, and we'll talk about that. But we're bringing back one of my good friends, somebody who's very inspirational, my sister, my friend, my inspiration, Dr. Yvette McQueen. How are you doing today, ma'am?
Hello, hello. Thank you for having me back on your stage. Thank you.
Yes, ma'am. And thank you for coming on our show last season and giving our listeners so much information. And actually, I think you were the first episode of season 3 last year. So, what better way to bring you back again to open up season 4? But you gave us so much, and it was an episode that I didn't think a lot of people would really kind of not really listen to, but like really take from it. But just know that your episode not only helped my family be more comfortable with getting the vaccine, but some other people that I didn't think would listen to our show, they did and said, "Hey, well, I listened to the doctor and it eased my mind to get the vaccine." And so, thank you so much for that.
Great. That sounds wonderful.
Yes, ma'am. So, just tell us, like, first off, give us an introduction. Like, tell us who you are and what you do, please.
So, I am Yvette McQueen, MD. I'm an emergency physician, travel doctor, and wellness lifestyle coach, a global physician on a mission to educate about health, travel wellness, and disease prevention. So, I assist travelers and staying healthy and safe while they're traveling their adventures, particularly internationally, along with also hosting a wellness lifestyle course.
And I like the part that you travel a lot. That's just I just want to know right quick, but during this whole pandemic, how was traveling? I asked you this before, but how was traveling during the pandemic?
It started off very scary. So about a year ago, we're in May. So actually, everything shut down March 2020. I didn't start traveling again until June 2020 because actually some of the hospitals canceled my contracts. So I travel around the United States and the Caribbean, working at the different ERs. So I didn't start traveling again until June 2020. It was a little scary, and I just did what I normally do, and I masked up. I wore a double mask, and I just started flying again because I had to work. I had to work. But as of course, in December, I ran and got my vaccine. I ran. I had to like drive an hour and a half to go get my vaccine but I went and got it. And the second one I got in January. And after that, it was a weight off my shoulder. I felt ease. I still double mask when I on a plane, but I don't wear a shield anymore because I'm comfortable with that. But I do the same things I normally do.
Where were some of the places that you would travel during this pandemic, and like, were you scared at all if this place had more cases, or what's some places that you went during this time?
So that's just it. I did my research ahead of time. So I wasn't working in any of the big, the COVID tents or any of the big hospitals. And the places I went had really a reasonable percentage of positive COVID cases. They all was about 10 to 12%. I did go to DC a few times for work and family. But when I went to DC, I actually drove. Um, it was from Atlanta to DC. It was a 10-hour drive, but I just prefer, especially in the very beginning in May and June, I decided to drive. But then I went to Ohio. I was in Virginia. I went to the USVI, or the Virgin Islands. And of course I had to fly there because I had to go across water. But as long as I know I was being careful and I put myself in just very cautious situations, kept my distance. And if people got too close, I would have had no problem telling them, back off.
Yeah, I would have done the same thing. It's like at the same time, I'm jealous of you because you get to travel so much. But at the same time, it's like it's very heroic for you to, like, a lot of people don't give y'all enough credit for what y'all do, especially you because you're a traveling doctor. So, but to go out there in these different countries and just to do your job, that thank you so much for taking care of everybody. I know y'all don't really hear that a lot, but
Thank you.
it would be selfish of me not to say, hey, you know what, she gets to travel, but she's really saving y'all's life. And y'all, I don't know how this country or this world can repay y'all for what y'all have done. But here on the show, we definitely want to give you thanks. But to tell you what, Doc, I got both of my vaccines. No thanks to you.
Hey,
Thanks to you. Actually, thanks to you. I got both of my vaccines. Let me tell you what happened. So my first one, I felt okay. I was a little sluggish. I had my vaccine, the first one in April, or my bad, it was in March. I had my first one in March. And I just had a sore arm. But that second one, it was Moderna. It was Moderna. The second one, wow. I had a 101 fever. I wasn't feeling well for like 3 days, but then maybe after 3 days, maybe two in bed and one moving around, I felt fine. I'm still here and things like that. But it was really you that kind of made me feel like, you know what? I got this. I got this. I'm gonna do it. I'm gonna do it.
that meant your immune system was working.
Okay.
So your first shot introduces the spike protein to your system. And like some people did feel a little achy or fatigue, or like you said, most people had an arm soreness. If you move your arm around a lot, you get that, people think it should stay still, but move your arm around a lot and that takes away soreness. The second shot, your body already knows about the protein. So when you get the second shot, it revs up your immune system and say, "Hey, let's go fight that foreign piece that just got in us." So the fact that you did get the fever and achy and the fatigue for a few days mean your immune system was working.
But what about those people who didn't get any symptoms at all?
It doesn't mean they don't have the antibody, they just have a different immune system.
Are they healthier or just
They're
doesn't?
healthy.
Okay,
They're
they're just healthy.
healthy. It's
Okay.
just but when then we got to remember it's just a little micro piece of the protein. So if they actually get infected with the real virus, the immune system will just rev up.
Okay. And of course, social media, people just like to ruin things, of course, scare people and, scare tactics. That's why I got you on the show because I think you've been one of our most straight up guests that we've had, especially when it's professional. So that's why I'd love to have you.
Thank you.
But one thing that I've seen, and like I'm getting older and I really hate social media now, but have you seen these videos of these people, they get the vaccine and they're now putting a magnet on their shot spot? Have you seen it at all?
No.
Yes. So there is, and if y'all listening at home right now or listening in the car, there is something on TikTok that where people or these conspiracy theorists are still going out And they say, because they say there's so much chemicals inside the shot that they're putting metals where the injection site is. It's really sticking. So it's kind of like, really, why are y'all doing this? I didn't know if you saw this or not.
I'm sure. No, I've never seen that, but I'm sure if they put the metal somewhere else on their body,
Hmm.
it probably will still stick because
Right.
it's something and not just where the shot is.
And I
It,
meant
I mean,
Magna. Sorry,
there's
Magna.
so much chemical, but I bet they'll go out and I'm sorry, I shouldn't call it, eat anything from a Whopper to a Big Mac to, and they probably put Cheese Whiz on crackers. Do you know what's in Cheese Whiz? No. I mean, you put processed food in your body, but you worried about what's in a vaccine.
A vaccine that's going to potentially not just save your life, but the people around you. So that's the
Right.
kind of doctor that we're dealing with today. And she is one of the phenomenal heroes that, a lot of people don't know her name, but we're going to make sure that that her name is being known, because we have a lot more with Dr. Yvette McQueen, the travel doctor, travel 911 doctor. We'll have more with her on the other side of the break. Make sure you stay tuned. This is the season 4 Show podcast featuring Dr. Yvette McQueen. Stand tuned.
Tired of the same old boring clothes? Want to support your favorite podcast but don't know how? Well, you're in luck. The Straight Up Show podcast store is finally here. In our Teespring shop, you can find all the merch that tells the world you're keeping it straight up. From t-shirts to masks to even leggings, our store has you covered. Just visit straightupshowpodcast.com and click that merchandise button. That's STR the number 8 upshowpodcast.com.
All right, guys. So we're back, and welcome back to the Straight Up Show podcast. This is our season opener, and we're with none other than Dr. Yvette McQueen, previous guest on our show, traveling doctor. It's just like, what can she do? She's been a hero. She's been very informative to a lot of people, not just on our show, but if you go to her social media page, she's giving tips how to be safe to travel. And so, once again, I thank you so much for blessing our stage today. Okay.
Thank you. Thank you.
Yes, ma'am. So let's get right into it. So, like I said, today we're continuing our impact of COVID. Like I said, this pandemic, this virus, has just killed over millions of people already worldwide. I think I don't even know, I can't even tell you the number right now. I think we're like at 600,000 right now in America that it's killed. And, the vaccination is being, now as of today of this recording, now kids under 15 to 12 can get it. So it's being available to everybody, and I don't want to take anything away from our previous administration in our office, but kudos to the administration for getting these vaccines out right now. Some have not been so. Before, okay, let's talk about the Johnson and Johnson. Like, what was the ordeal with the Johnson and Johnson vaccine? Like, that put a big scare to people. What happened with that?
Okay. So the Johnson and Johnson, just like the AstraZeneca. So the AstraZeneca was actually approved like in the UK and Europe and places in Africa, not here yet in the United States. Johnson and Johnson was approved here in the United States. It's a different kind of vaccine. It's called what we call an adenovirus vaccine. So the Moderna and Pfizer is an mRNA vaccine, which is a new technology that just takes a protein and introduces it to your system. The adenovirus one, like the Johnson and Johnson, is actually a dead virus, like the influenza vaccine. So, and what it does is take the dead virus, adenovirus, and attaches the coronavirus to it so that your system recognizes it. Um, the problem was that it was causing, they noticed that they had this rare form of blood clots. Now, it was like 1 in a million of cases that it is. Unfortunately, in a couple of cases, people did die from it. But what they're saying is that the risk of the 1 in a million people getting the blood clots versus, like you said, the 2 million plus people that's died from COVID, it works out. So it's a rare blood clot. So like when people come to us and they tell us, oh, we have these symptoms, we have blood clots, we automatically say, oh, let's give them a blood thinner, a certain type of blood thinner we give them, heparin, so that they don't get blood clots in their lungs. Well, I guess since it's a rare type that these blood clots did not respond to heparin. Heparin actually made it worse. So the reason they put a pause on it is to say, if this is causing it, we need to educate our medical people how to treat it if someone comes with a side effect. So that was really the pause of it. Is they didn't want to pause the actual vaccine. They wanted to pause to actually let the medical people know how to treat the side effect.
Now you know. So you hear it here first that Johnson and Johnson is okay, right? It's
Yes, it is.
okay. It's okay. So don't be scared. Just like she's telling you right now, this is a licensed medical professional. She would not steer you wrong. Like I said, she is one of our most straight up guests that we've had on our show, and so that you hear it first. So with that being said, I told you all today that I've already had both my shots. I had a little fever, but I'm feeling fine. I still can stick and move. I had my personal surgery done, which according to insurance, it was cosmetic. That's a different story. Uh, no dig, but I'm good now. So with that being said, I got my shot, feeling good. All right, now I'm about to tackle the world. I got my vaccination. Now what? As you know, so many people, or especially here in Texas, we never really closed, but everything's opening back up. Here in Dallas, we had a boxing match this previous weekend. It had 73,000 people
Wow.
in the arena. Yes. At that time, it was the most the heaviest crowd arena event since the pandemic. This is in Dallas. And there are people who were masked up, in the arena, but there were some who were not. You'll watch some NBA games. There are some people in the crowd too. So people are vaccinated, and and I'm guilty of this. I'm not gonna lie to you. Like, just sometimes, like if I go to like get a Starbucks, I don't have my mask on the drive-through. Which is kind of irresponsible on my part. But I subconsciously have fallen into that bubble. I got the shot now. I'm okay. I mean, tell me how people should react and why people shouldn't be so comfortable now that we're vaccinated. Now what?
Okay. I got the vaccine. Now what? So the requirements are that you can go maskless in certain situations. So if you are in a household and all of you are vaccinated, of course you've all been living with each other. But basically, I say it's all in who you trust and what you trust their environment has been. So two people that have been vaccinated together can congregate indoors with small amounts, indoors and outdoors without a mask. They're saying people that's been vaccinated can be outside, um, because of the air circulating. If you're inside with a crowd, though, they still suggest you wear a mask because you don't know if everyone is vaccinated. So if I'm in a house and say friends are having a little get together of 8 people, and I know all those 8 people are vaccinated, I feel comfortable not wearing my mask. If I'm in a house with 20 people and I don't know some of those people, I'm still going to wear a mask, or I may choose to stay outside on the porch and be outside where there's more ventilation. 73,000 people. I think I still will wear a mask on that. Now, if you go through the drive-through, I'm gonna be honest with you right now, you're vaccinated. Maybe that worker is or not vaccinated, but you got to remember they got that plexiglass still up. They're still doing the plexiglass. You're in your car, enough air circulating in between. I say if you didn't put your mask on right away or forgot to put it on, I think it's okay. I think it's okay. Now, I'm going to throw a wrench in something here. There has been what people said breakthrough COVID for vaccinated people. There's a very small percentage, it's less than 1%, but there are people that have had their vaccinations and they're past their immunity, which means their immunities where they're past 2 weeks of their second shot or their J&J shot, and they have contracted COVID. Those have been I've heard about it in the medical arena, nurses and doctors. I haven't heard about it in the public. But when they do get COVID, they're like, you know what? I felt like I had sinus. I felt like I had a cold. I had some symptoms. They'll go get tested and they're positive, but they're not getting that life and death situation where it's affecting their lungs. They end up in a ventilator. They say, I felt like I had a sinus infection. I felt like it was a cold and I was positive. So it was a breakthrough. So we don't know if that's due to a different variant, what they call, but they're just getting those mild cold like flu like symptoms, but because they are vaccinated.
Right. And I just got news right now. I'm looking at it right now. Joe Biden just spoke. He said that he ultimately hopes that every American will be vaccinated here pretty soon. Ultimately, keyword ultimately. So, kudos to him for saying that. That's news that just broke right now as we're recording this. So, you said different variants. Like I said, that's great to hear. I got two follow-up questions to what you just said. One being like, I know you travel a lot, but I know that we get numbers from the news and stuff like that, but have you seen a decline of people being, I guess, hospitalized because of COVID?
Yes, I have. It's definitely declined. Actually, it came out this morning. I can't remember which report was they saying, but it's declined significantly. All of it's declining. We're declining as far as the cases because they said even in January, they would have an average of 3,000 new cases per day across the country. And yesterday, I think it was 784 cases across the country. Hospitalizations, definitely. There's some hospitals reporting they haven't had one new COVID case in the last week. Of course, they haven't had any deaths either. So all of it's the new cases, the deaths, um, is declining. But I'm throwing it out there. It's still out there, especially if you are not vaccinated. Please, please. We are still in the pandemic. And remember, the pandemic means it's a very infection that's highly contagious and spreadable across the world. So just because the United States is going down does not mean we're out of the pandemic because we got to look at India. Oh my goodness, a million people die within a week. I mean, they can have 4,000 cases in a day. Uh, it's just,
And that was my next follow up question. You mentioned and you said we actually talked about India because that scared me. I mean, it was like 500,000 in one day on on a Saturday. It was like 500,000. I was like, on a Saturday, and
mhm.
that was scary in itself. So I didn't do my research much about why that was spreading so fast. But is that because there is a different variant, or
There's a few factors. I know when they came out with the variants or the UK variant and the African variant, and I think there was the Brazil variant, but they did notice that the vaccines did protect you from that because a lot of the vaccines, like the AstraZeneca and the Johnson Johnson, was already in South Africa, so it was able to protect you against that. The Indian one, they don't know yet. I think there's been one or two cases in the United States they've picked up. Of course, it's going to eventually get here. I'm going to be honest with you. But it's a different variant, and they don't know how it will respond to the vaccine. Now, it's getting there is different because if you understand India and their population, particularly they had a few of their holy days or their holy festivals, and they could easily have a million people in one area, and then they go back out to their countries or to the countryside and they're spreading it. So it was all about distancing and contact, and also their medical system, which I tell people, when you travel you need to know what their medical system is. Their medical system can't handle it. They can't handle that population. We almost, actually, some places in the United States didn't handle it, and some hospitals did run into supply, maybe, but I don't know of any hospital saying I can't get oxygen. Their hospitals can't get oxygen, and I mean the people are laying on the floors in the hallways. They're turning people away. They don't have the medical healthcare system to handle the amount of people that's getting sick.
that's I don't know. I couldn't even imagine, and that's why I say that a lot of people don't understand how much privilege we have here, and like I said, a lot of y'all. are working nonstop. And to go back to another question I was going to ask you, since you noticed that there has been a decline in hospitalizations in hospitals that you go visit and work with, has the morale has it been better now since there's less stress on y'all? Or I mean, I know that my sister, she was working like crazy hours, but I mean, and I'm not for sure if you're traveling this, but has the morale, how's that been with among your colleagues and stuff like that?
Um, yes and no. So yes, we're less stressed, we're less busy, we're feeling better about it. But now we can go back and reflect to see what happened. So a lot of people are going back and reflecting what happened and saying, "Hey, the administration and not the hospital administration. Some hospital administrations took care of their people, and they were great. Other hospital administrations did not, and people are mad about that. And so they're actually." They're leaving jobs. A lot of people are leaving jobs. We're now having to where you when you're in the midst of a trauma or something, sometimes we're dealing with what we know. What we're doing, we're taking care of people, what we're supposed to. Now that we're reflecting back on some of the things that happened, people are going through post-traumatic stress syndrome. I know a lot of the doctors from New York, they was like they didn't work for 2 or 3 months because it's like I can't handle it. And when they went back, they were like, okay, I think I need to work less. So some people are decompressing and readjusting their life. I say that's where people are right now in the medical field.
And with that trauma, I mean, because this is stuff that y'all have tried to warn the country about before, even before it even got big. And then, I can attest to my sister, like I said, but just um, one thing you said, that variant in India, it will come here eventually, like the UK when it was in Colorado. Um, if you can speak to people right now, or who people are higher authority than you, or the people in the government, what's a piece of advice that, or something that we as people, or people who are not in the medical field, what can we do to prepare ourselves should COVID-19 or something like this ever happen again, to not only to help us, but to help you take care of us?
Okay, it's gonna happen again. If it's not gonna be coronavirus coming back up again, it's gonna be something else. We're just in that stage. What basically is prepare and listen to basically the scientists, and actually the one they this was predicted more than 10 years ago that there was going to be a pandemic, like because of course it was what 1918 was the influenza pandemic, and at that time science didn't know a lot, and they said but there's going to be a pandemic, and a lot of people felt well our hospital systems can handle it. Well, they couldn't because the hospital systems had cut back so much. They had cut back in supplies. I'm sorry, rather pay the CEOs 7 and 8 figures than actually, order enough supplies or have enough nursing staff. This is the end of Nurses Appreciation Week. Thank you, nurses. But, they went down from, a nurse having 3 patients to one nurse, and now it's like 6 patients to one nurse. Plus, they cut aides. They used to have aides to help them. Now they want the nurse to do the nurse job and the age job, and then nobody's there answering the phones. So I just experienced this because my mom was actually in the hospital in January and February, and I was there. They let us go in the hospital one person at a time, but you call for something and it would take an hour to get there. Or, it was like they didn't have any aides to bathe her. So I was actually doing her daily bathing. So it's just, and I keep saying, is it because of the COVID shortage? They're like, no, it's staffing. It's staffing. But that's what we're going to.
Right. And like I said, I don't know how it is in other places. I just know that I know in Louisiana, it's like either you work in the oil field, you work in the medical field. And like there are so many nurses in the nursing program. Like, I'm like, they need jobs. Like, hook them up with jobs, man. So I think that would be, we'll definitely try to fight for that somehow, because I mean, to see y'all come through with this, to see like B-roll of people on CNN and different news stations with their heads just down because they're so stressed out. Doctors just stressed out. Like, and I even hear stories about y'all having to camp out at hotels just to go back to work in 2 hours because they didn't want you to go that far. That is crazy to deal with.
Do you know
So,
that and the suicide rate has increased?
wait, what?
Suicide rate in the medical professional has increased. There, I last month I know three colleagues, three doctors that killed themselves last month in the last
Wow.
month. And you think they're going fine and good, and one was on social media one day, and the next day he was dead. So you never know what people are dealing with. And even though you said there's a lot of nurses in the nursing programs, it's in any job where you overwork people and abuse them and feel and make them feel like they're just a warm body that they can be replaced, that they're just doing a job, they're not going to stay. So yes, we love to take care of people, we want to take care of people, but there's also just so much that the nurses and doctors, and it's not just the nurses and doctors. I'm telling you, when I told you about the post-traumatic stress, it's not just the nurse and doctors, it's everybody. This is a team player, so it's everybody. It was the registration clerks that had to see people die. It was the people cleaning the rooms of the hospitals there. It's the people bringing our meals that was there that had to change their jobs. So it wasn't just the nurses and doctors. The hospital has a lot of compartments and people, and they have all been affected.
Whew, that's a lot to deal with. That's hopefully, I know. I think the last time we spoke, you said that you don't see this being like clear until like 2022. Is that still your prediction? Still?
It's getting better with the vaccine. I think, especially like you said, they just recently approved the Pfizer. I think it was the Pfizer to down to 12-year-olds as of today. So I think we're never going to be like we were pre-COVID. I'm sorry, life like that is never going back. But we will start to move again. Kids will get back to school again. But my thing is, if someone is out in public and they want to wear masks, don't shame them because they're protecting their own self. Because some people don't want to wear masks, some people will wear a mask, and it's going to come to a point people are going to decide to wear a mask. Either it's not or that. I see maybe late fall, but still, I think of 2022, as far as if you're thinking about us getting back to travel, us getting back to semi routine of pre COVID, but I don't think it's ever going to go back to pre COVID. Things have just changed in life. It just has.
It really has, and I'm going to go back and just kind of correct myself. I took the Pfizer vaccine. I think I was just more homophobe, but I couldn't pronounce Moderna the right way, so it was on the tip of my tongue. So I was like Moderna. Oh no, I had Pfizer. I took Pfizer. That was the one that made me feel the way I did. But I guess I'm still here. I'm still fine. But people are in a rush to get back to normalcy right now. They got the vaccine, they're good to go. Some people just didn't even care to get it at all. They just see other people going out and celebrating, having a good time. And so we have summer coming up. We have, it's going to be summer traveling. Airlines are seeing the pick up right now. I think that Mother's Day, I think it was like 1.7 million people traveled.
Mhm.
That was a upkeep. Now we get to see if that is going to play a factor of rising cases. So you are the travel doctor, right? And we're going to talk more about traveling more, but you know, is it safe right now if I'm fully vaccinated that me and my family can hop on a plane, go to California, and go to the beach and do our thing? Do you think since I'm now vaccinated, I can go out and do that at least? Not go to a 73,000 boxing event, but do you think that's okay right now? Or
So yes, they said that even though they're recommended non-essential travel, but as a vaccinated person, they say you can travel. You still have your wear your mask on the plane and in the airport because that's a federal mandate. So I would say wherever you go and research the destination. So if you go into a certain spot in California, look to see what their infection rate is. They usually like to say 10% or less as far as new cases of infection rate. For you, if the hotels are very safe, I feel very comfortable staying at hotels. I feel very comfortable staying at rented facilities, whether it's Airbnb or VRBO. particularly with families, because families are doing that and cooking for themselves, and they can be maskless doing that way. Going to a beach, I would just research, is the beach open? There's still some beaches that have curfews, like nightly curfews. Where's a good place where you not overcrowded at this point on the beach, and also the activities of the destination, because the activities they're still. I mean, they've opened Disneyland, they've opened Disney World, but they still only letting so many capacity in there. They still have certain rules, and you have to get advance ticket or reservation. So you need to know what the rules are, whatever. Like even Yellowstone National Park, that used to be somewhere where you could just walk in. They're taking reservations. You just can't like loudly go up in there anymore because it's just so many people want to do the national parks and outdoors now.
Okay. All right. So I guess I might try to, because I, I think I suffer PTSD a little bit just not leaving my house. I work from home, and because I got everything. I got the gym, basically haven't used it. But it just I've gotten so comfortable to be at home, and so just to break out and just to have some sense of like I can go out and be careful. Like can I go? I mean, do you think it's wise? Because me, I'm a big guy. I'm not, I don't have any besides being overweight. I don't have any pre-existing conditions, and I had lung issues before. But like, is it safe to go to the gym and like, sweat it out, and or the shots still be precautions and wear my gloves and wear my mask? What do you think?
Okay, you don't need gloves. I'll tell you that right now. So is once again, it's not high contact. It's like you just got to make sure if you're touching things, don't touch your face and eyes and mouth and things like that. Just like with the flu. As far as the gym, you need to look what your gym practices are, what their practices are, how many people are in. I would go in a less time when a lot of people not there, and people think, oh, early morning or early evening. No, that's when most people are there, like maybe 12 noon or 2 o'clock in the afternoon when there's less people there. You have to know what their cleaning um, process is. You need to know what their ventilation system. So you got to remember, this is an airborne. So if someone was there, even though they wipe down the equipment, do they have good ventilation system? So that's just something to investigate about your gym.
Okay. Okay. So still might try to cut back a little bit still. Uh, okay. So one more question, then I'm gonna go toss to a break. Um, so what's your prediction for this winter? Like, do you think that's going to be any like okay coming? Okay, so we got people. There's going to be let's face it, people are ready to get out. They're going to basically go crazy this summer and probably just do it big, basically. You know what I mean? So we're going to carry into my favorite season, Virgo season, for obvious reasons. If you don't know, it's my birthday. But so and I tell you a dad joke. You want to know about Virgos is so cool? Because during Virgo season is when the weather's really hot and it starts to get wet. Really cool. Ba-doom-boom.
Ah,
Ba-doom-boom. But
okay.
no, but no, but during this type of season, people have done it big in the summertime, and then you got people spreading stuff around, and we get into the winter season. Do you think that there could be a potential spike with people vaccinated, but we have people doing it big in the summertime? Do you think that there could be like a bad winter at all?
Well, there's probably going to be a spike in fall just because there generally is a spike anyway. So if you think about it, everyone's out in the summer. There in the United States, 50% of people are not vaccinated yet. Remember, President Biden said he hopes to get there, what by July 4th. He wants it, but they're not looking for herd immunity until they're what I think 75 or 80%. They're not going to be there. Way the vaccination has slowed down. So in those fall, things spike anyway, like colds and flu, because as kids go back to school and people come back from vacation and they go back indoors, they're more indoors. So that's when things spike anyway. Now the point is it going to spike? Coronavirus will spike, but not be as severe as last year because people are vaccinated. It won't be as deadly. You got to remember, as
Okay.
deadly. But there are also going to be the people that aren't vaccinated. So even if you're just because you're vaccinated, don't mean you can't give it to someone else. So it likes to live up in that nose, and you're vaccinated, you still may not feel anything, and you come in contact with someone that's not vaccinated, then they could easily pick it up too. So I think there is going to be a spike. I just don't think it's going to be as deadly as it was last fall.
And that makes perfect sense because it's an airborne disease, and just being people, especially us as Americans. Like, well, I got sick now because of the coronavirus, and well, so that means the vaccine doesn't work. You know what I mean? Like, what's gonna happen. That's just
You
me
know
being
what's
real.
up right now? Now that people are starting to take off their mask, cases of the flu are up. There's been a spike of the flu.
In the spring,
Yes, spring flu. Yes, because people are no longer wearing their mask and they didn't get their flu vaccine. So, so been an increase of the flu and what we call RSV, or respiratory syncytial virus for
mm.
kids. Yes.
and this we've been so kind of flooded with coronavirus that people just think that, oh well, if I get this immunization or this vaccine for the coronavirus, it automatically protects me from flu too.
Right.
Because you know what, me, just not even thinking about it, I'm thinking, well, you know what, man, the flu is still around, right? There's other diseases and viruses out there. Wow. So this is why I love having her on the show, because she makes us think so much about our medical stuff. And then she's going to talk to us next, coming about, us traveling. And guess what? She has a brand new book coming out that I'm going to add to my summary list because I want to travel. And she talks about, the obvious things. What kind of foods to eat to stay healthy while traveling? We have more with the doctor, Yvette McQueen, on the other side of the break. Stay tuned.
Straight up means to be able to speak in a way that is straight up, to be honest, and to speak your truth.
Raw, uncut, you know what I mean? It's blunt, straight to the point. This what it is.
It's just a place to be open and honest, and that's what I appreciate most about it. And it provides a place for community members to come together and just be straight up with each other about things that are going on in the world, because it affects all of us.
Unfiltered, raw, with all the cursing that Calvin does.
Straight up is just being real, telling it like it is, being you.
Being solid, being who you are, no matter what it is, no matter what situation you're faced with. All right, this is who you are. It really speaks to me, saying it is what it is and it ain't what it ain't. Straight up.
Hey, Calvin here, host of the Straight Up Show podcast. And guess what? We're back, bigger and better than ever, with new guests, new straight up topics, and a new way to support the Straight Up Show podcast. That's right. You can now support our podcast by becoming a Patreon patron. Straight Up has 4 different tiers that you can choose from, with each tier having their own perks. Your monthly donation helps us produce efficient Straight Up content that you love so much. For more details, visit our Patreon page at patreon.com/Straight Up Show Podcast 318. That's patreon.com/Straight Up Show Podcast 318. All right, welcome back to the Straight Up Show Podcast, season opener with the one and only Dr. Yvette McQueen. I had to keep saying it because, like I said, she is the one and only. And how many traveling doctors do you really know about that just keeps it so real? So once again, I got to say thank you for coming on our show.
Yes, thank you.
So guess what, everybody? She's phenomenal. She's great. But did you know she's also an author? Because guess what? She has a brand new book coming out called Travel 911, a health guide for adventurers. Dr. McQueen. I hate, I'm from the South, so I hate calling you by your first name. It just feels so bad doing it. I know my grandma would get so mad at me for doing it, but Dr. Yvette McQueen is here with us. She has a brand new book. And so it's basically about traveling and adventure, vacation. And, you don't want to get sick and have these emergencies while traveling. So Travel 911, a health guide for adventurers. Can you explain to us, what is this book about?
Okay, so I call it a doc in your pocket. Okay, a doc in your pocket. So once again, you don't plan to get sick. People they don't plan to get sick. They don't plan to have injuries. You don't plan to fall off that ATV while you're on some sand dune somewhere. Crap happens. I'm just gonna say that it does. You eat the wrong street food, you end up having diarrhea for 3 days, and then you get dehydrated, and then you can't get on the plane. It happens, and I'm saying that because, before I started all this business, it would happen. I would be in groups or I'd be with people and they get sick. And who would they would come to? They would come to the doctor. So this is all things that would happen. I was like, wait a minute. This is what I've been doing all the time. Let me just start doing it for everybody and spreading the information. So now that's why I did Travel 911, because this is just a quick guide. It's not a book that you feel like you can read it from front to back. It's an easy read, but you can carry it with you and you go, oh my goodness, you know what? I'm all hot and I'm just over hot and I'm sweating too much. So you go to the chapter on heat related illnesses. See what you need to do. If a friend is getting overheated, this is what they need to do. This is what they need to drink. If you have bug bites, you go to the bug bites area and say, what do I need to put on my bug bite? Or the first chapter is just telling you things you need to pack, like your medications you need to take, preventative things like, okay, you're going out in the sun, take a hat and sunglasses, take a cooling rag, other first thing. And then was the one thing, because I do teach, CPR, first aid, and I also teach wilderness medicine. So my thing is, it's a quick chapter with some pictures, and I'm a picture person. A picture, I give a little words, but you may need to see the picture. If you out in hiking, say in Utah, you go into the horseshoe bend that everybody likes to go to, and you twist your ankle and you don't have cell service and you don't see anybody around, what do you need to do? Okay, you got a magazine in your backpack, or you find some twigs, put it around your ankle and put a scarf around it so that you can walk out of there. So it's like just a quick first aid of what common people can do, for medical problems that happen while you're traveling.
And what's crazy? That's a good idea because I live 3 hours away from my hometown, and me, I hate driving. That's just I get tunnel vision way too easily, and it just like even going home, because I knew that when I go to Louisiana that my allergies was going to kick my butt. And sure enough, the moment I got out the car and I just see pollen everywhere, I said, "This something about Louisiana weather just makes my." And I said, "You know what? I don't have any kind of medicine because I had a surgery, so I have like special kind of they made like a mixture for me to like take my medicine, whatever, like droplets, whatever." So I'm like, man, you know what? I'm gonna be here for a while. I don't have none of my medicine, like. So that is such a genius idea to have this, and can you tell us? You said you got pictures in it. Um, do you talk about your experience traveling this past year in this book?
No, this is more of a how-to guide, what to do. There's a couple areas in there I say that, of course, as of March 2020, a pandemic, wear a mask, social distance. But no, it does. This is not about my experience. You got to follow me and listen to me either on Facebook, Instagram, Twitter, LinkedIn to keep up about my travels.
Yeah. And hopefully, you know what? And I mean, dare I say this, but maybe that could be in a book in itself. To say, hey, this is what I had because you've traveled during the pandemic. So you've seen what people need already, which is why you have the guide. But you've seen. I mean, I can't. I hate to be so blunt, but you've seen the coronavirus up close and personal in different areas of the world, and just to have that, just to know what you went through, I think, in my opinion, that's just award-winning experience in itself. Not the the death of somebody else, but to see how different areas of the world faced the coronavirus.
Yeah, that's a consideration. Maybe I'll get like 10 or 12 friends we all do it together and see our different perspectives of it.
And I like seeing that you and your colleagues, especially on Clubhouse, y'all come together as a group, and I'm like, I've never seen doctors just really like talk like this and actually communicate, especially doctors of color. I'm like, wow, y'all really giving us this feedback. That's why I had to have you on the show. But her book is Travel 911, a health guide for adventures. And like I said, people are going to be traveling this summer. So you need to get this book. So if people want to get this book, Travel 911, where can they find this book and pre-order this book?
Okay, so it's out hopefully the first week of June. It's being printed right now. It's available. You can get it at travel911book.com. So that's travel911book.com. Real simple.
And it's a doc in your back pocket. It's a doc,
Doc in your pocket. Yep.
and it's like you gotta have it. And like I'm telling you, because and I think something that you said earlier today, you said that when you go somewhere, scout out everything like medical, like the doctors and things like that, because it never makes sense to do that when you travel. It never does. I'm like, you think about it, like the neurovirus, right? I went on my first little, it was a ferry ride, right? And
Hmm.
I got sick, and I said, "What is it?" It's the neurovirus. So apparently, that I didn't know that the neurovirus spreads so easily on cruises and stuff
Yes.
like that. I didn't know that. And let me tell y'all what: if you don't know what the neurovirus is, like look it up, and you want to be prepared if you go on a cruise because like seasickness, that is real. That is a real thing. And I was on a ferry. So I can
Hmm.
only imagine how it is to be at sea and things like that. So y'all make sure y'all get this book. It's travel911book.com, right? Is that right?
Yeah.
Yeah.
Travel911book.com. Yep.
And you can't see it right now because I haven't edited this yet, but you'll see it right here, the link where you can get it at. So make sure y'all go get this book out. So with that being said, I'm gonna go ahead and shift over to this. So as you can see, I'm not the skinniest person in the world, right?
Okay.
So I know a lot of people have been reaching out to you about just getting like several healthy eating tips while traveling. You know, because I mean, we've been eating a lot at home. Don't lie. A lot of y'all been eating. DoorDash has been y'all's best friend. I know I have my year subscription already, you know. But you know, we're back in. I told Dr. McQueen, I said it's the COVID-15. Got that 15's power added on, more than 15 for me. But with that being said, I know a lot of people have been hitting you up now that things have been opening up. They're vaccinated. Now they want to go out and travel more. So you need this book. You need some essential guys, but you know what? You want to be precautious what you eat. So, like, what have you been telling about people about just like some eating tips they can do when they're traveling, or just kind of like not go crazy when they go traveling?
Okay, so the restaurants are back open. I'm glad that for the restaurant workers. So 7 tips for eating out while you're dining and traveling. And I actually made this a few years ago, but it's still very, very, very up to date. So one, portion control. When you go, the United States diet, they give just too much food. I'm just being honest because a lot of people like when they travel other places, they didn't give me enough food. That's because it was portion control. And so if you just do portion control, your protein or your meat should be 3 to 4 ounces. Make sure your sauces are only like a quarter a cup, or don't spread, oh, I'm getting a salad, I'm being healthy, and then you like drown it with dressing. You might want to substitute the croutons or the high carbohydrates with something else. You should have vegetables. So your plate should always look colorful. You should have two to three vegetables on there, your protein, and then just a half a cup of your starches. So portion control. I tell people every piece of food should have some real estate on the plate, which means they should touch the plate. Don't pile it on top of each other. So that's one thing. Another thing is go ahead and make substitutions. It's okay because you can tell people, are you cooking that with butter or can you use olive oil? Can you substitute the bread for like a pita or something less carb, or just take the bread off and have an open face sandwich? Watch for different add-ons, and a lot of things have sugar in it. You don't believe ketchup has the sugar in it, salad dressing has the sugar in it. So watch for things like that. For make your own request. So don't be shy about requesting for something in a restaurant and have the waiter over you going like, come on, come on, come on. If you want something baked or broiled versus fried, find out. Because if they say, well, we can't do that veal because it's already breaded, or we can't take the bread, that means it's not fresh, that is frozen. So things like that you should find out. 5, watch what you're drinking as far as your drinks. Water is always great, a little flavored water, but don't drink your calories. Don't drink a whole 2-liter soda at a sitting. And I tell people some of the diet sodas actually has the sweetenings in there that actually give you more temptation. 6, make sure you're eating the same time each day because your body likes routine and is craving things. So when you wait too long for meals, you actually end up oversaturating yourself. And then that's the goal to 7. Don't overindulge. Give yourself some grace. Don't deprive yourself eat what you like, consider substitutions. So if you want that piece of cake, maybe you're going to skip the mashed potatoes at dinner. And always wait 20 minutes between your meal and dessert, because you're right. Your stomach needs time to catch up with your brain. So you're actually full, but your brain don't know it yet because the stomach didn't send the signal. So that's why they say always wait 20 minutes after you finish eating to decide whether you want dessert or not.
Wow. Wow. Now you're making me feel bad about myself.
No.
Because I'm like, you know what? Do you want dessert? Top me off. Bring it up. Let's do it.
Or take it to go and take it to go.
I've heard that you take your dessert to go. So let me ask you, because like I think, and this is my opinion, I think that the complete opposite should happen now that we are going to start traveling more. Because I know I am. Is that you want to eat healthier now because we've been at home. You know what I mean? And like you saw Will Smith. Like he's been at home and he's like, you know what? I got that dad bod. I got this 12-week challenge now to do his thing. I'm trying to do it too. But my thing, I cannot give up like dairy. And that is so hard. Like I love dairy. And that's the hardest thing to give up. But my friend, he wants us to start doing this Foodie Fridays. And I'm like, he wants to travel. I'm like, man, that's the worst part because the best food is when you travel, because you never get it in your hometown. So those are 7 healthy tips just to kind of be portion control. And you always can take it with you because it's not going to go anywhere or explode.
Yeah.
So,
And if you don't want to give up dairy, just consider getting either 2% or low fat dairy.
I gave up milk altogether. I don't drink milk. It's just cheese. I'm like a cheese crackhead. And so I don't know why that is, but I just, it's just cheese. But that's my guilty pleasure is cheese. I don't like ice cream. I just like cheese. It's just, I'm like, I always say, if I make enough money, I'm gonna get a Whopper with cheese. and now I got a little spending money, and like I can get that extra 25 cents and bam, throw it on there. And so, so we're having fun with Dr. McQueen, and she's been a great help. Like I said, she's always straight up with us on the show. So, if you can give, lastly, before you go, if you can give any advice to people, just that's skeptical. 2 questions. Those who are still skeptical on getting the vaccine in itself, what could you say to those people? And those who are scared to travel now that they have the vaccine, what would you say to those people? Those 2 questions.
Okay. So if you're still skeptical about the vaccine, I suggest you talk to someone you trust. You need to talk to someone in the healthcare or science field that you trust. So it may be your primary care doctor, your cardiologist, the nurse the school nurse. Talk to them how they feel about it so they can give you the science. So it's not about hearing it on the news from someone you don't know. You need to hear it from someone you trust. Okay. If you're still afraid to travel, even though you're vaccinated, I say start small, start a little bit, do something in your own city. People don't realize some of the advantages or tourism in their own city. So go to your city tourism board or your state tourism board. Even if you're not in a big city, I'm sure go to the next town over. There's something in your state. Like I'm in Georgia and there's the caves and the waterfalls in northern Georgia. I mean, that's only an hour away to take an advantage of. So just start small by doing small things like that.
And it's kind of getting you ready to be around people again. You know what I mean? Something like going to the caves. Like I would do that because this is something that I struggle with right now. Like I'm struggling to get out of the house and do something because my friends are not. They're still kind of skeptical still. And me, I'm like, I'm vaccinated. And this is big for me for my mental life to get out the house. Because at first I was just going like back and forth from the apartment, just going back and like walking up 20 minutes, something like that. But now it's kind of like I wanted to step my game up now. But then like when I go out, I'm in Dallas, so like people are like just like flooding everywhere. It's like, no, wait a minute. There's a minute people. I need a 50-person count to be around me, not 73,000 people. You know what I mean? So,
try a neighborhood park or a neighborhood track and go walking around there.
Okay. All right. Try this. Hump small. I'm crazy. So once again, we had Dr. Yvette McQueen, the travel doctor. Make sure you get her book, Travel 911, a health guide for adventures. Make sure you go get the book at where is it at again?
Travel911book.com.
Okay. And then, so before you go, just make sure you just go ahead and give us all your social media, and make sure I'm reading this correct. So if they pre-order your book right now, what do they
Mhm.
get?
You get the book autographed by me, but I'm also giving what I call a mini travel kit, and it has a mask, a little small medical kit in it, hygiene, body wipes, the disposable toothbrush, and like some body wash.
And I'm telling y'all, I've traveled 3 hours away, I've traveled 5 hours away, and it's always something that you need when you travel. So you better get this book, because not only would you get informed, but you get some free essential stuff that you need. So make sure you go to travel book now, or travel911book.com. Pre-order her book. Will be out June 1st, right? June 1st
Yes,
everywhere.
yes.
June 1st. Get it. We'll definitely promote it on our website. We'll have a link to it down below. But can you tell us how people can reach you by social media and your other websites as well?
Okay, so I keep things pretty simple. So I am Yvette McQueen, MD. That's YVETTEMCQUEEN, MD. So my website is YvetteMcQueenMD.com. Social media, Facebook, Twitter, LinkedIn, and YouTube. I am Yvette McQueen, MD. Instagrammers, Dr. Travel 911.
And like I said, I am so proud of her, and just being somebody that I interviewed to see. I don't know if you always see my congratulations. I'm always like clapping for you when I see your post. Like I started clapping. I'm like, I'm so happy, and, because she's an inspiration. Like I said, just to see the impact you made on our listeners about the vaccine itself in the beginning. I can't thank you enough, and I can't thank you enough for coming on our show. And I invite you, as always, to come back to give us more information if you can.
Thank you. I've enjoyed it.
All right, and that's a wrap for us here on the Straight Up Show podcast. I am your host, Calvin, here with Dr. Yvette McQueen. Until then, there's only one rule to our show. You got to be straight up. See y'all next time.